Why and when you will measure the blood pressure in children? In below 3 years and or 6 years, you have some low endowment situations like preterm, low birth weight, your is small for gestational age, IUGR, you know, and the acute kidney injury in the neonatal period, can cause reduced nephron mass, and thereby can cause hyperfiltration injury and long-term CKD progression. Kakut, by far the commonest cause of CKD, is also in the congenital. So, as the name says, so they have early presentation, may not be florid presentation. Infection. Rarely, your hematuria proteinuria, GN is a little bit older age, about 6 years, 10 years or so. So, drug like steroid, your your CNI, who can has a renal impairment, the congenital heart disease like coarctation of aorta, transplant, your malignancy, they are common. Above 3 years or 6 years, you have obesity, you have the metabolic syndrome, you they can cause renal damage and can cause CVD progression. So these children, even before the creatinine goes up, these children may have can have hypertension. So measure the blood pressure of these children routinely. In dengue, hypovolemia and hypovolemic shock, one of the important cause of death, by far the commonest I would say. So those cases also need the blood pressure measurements. Patient with high fever, dengue-like symptoms, no, the childhood hypertension leads to adult hypertension. In fact, 2.2 years less survival in the children with hypertension in the long term, and 60% of the more cardiovascular events, MI and stroke, are with the hypertension, and 25% of the adult population hypertensive, of which 4% are children. So thereby measuring blood pressure of children is important. We have 20% children in the city, and 80% in the village has who has hypertension. So obese, and as well as some of them are hypertensive. So blood pressure of these children should be measured. Secondary hypertension is said to be more common in primary, but current growing obesity is saying different picture. The primary may be higher. So hypertension doubles the risk of renal damage, renal failure, and triples the risk of stroke and death. Thereby, measuring blood pressure is important, and in each every almost in every setting, almost in every child should have his blood pressure measured. But children with this known risk factors must be measured their blood pressure.